We're at the 2019 CROI. We're here with Catherine Chappell, who's with the University of Pittsburgh, and we just got out of a press conference that we're going to describe, or you're going to describe the study that you presented in there, and your work, and we'll do a little Q&A after that. So, if you would.
Do you want me to give some background too?
Yeah, that'd be great.
Okay, yeah. So I live in Pittsburgh, Pennsylvania, which is in the Appalachian region, and it's been well documented that there has been a rise in hepatitis C among young people due to the opioid epidemic. And as an obstetrician, I treat pregnant women, and we've also documented this increase in pregnant women. And the problem with pregnancy is that hepatitis C can be transmitted to the baby, and about 1 in 20 babies will become infected during pregnancy. And currently, unlike other infections like HIV or hepatitis B, we can't do anything to prevent perinatal hepatitis C transmission. So with the advent of the directly acting antivirals, there's an opportunity not only to prevent perinatal transmission, but also to treat maternal hepatitis C infection and cure hepatitis C infection while pregnant women are engaged in care. So this was kind of the impetus to the first study, which we just did, of hepatitis C treatment in pregnancy. We enrolled 9 patients and started them on ledipasvir sofosbuvir starting at 23 to 24 weeks gestation. We continued this therapy for 12 weeks. And it was completed before they delivered, and then in the postpartum period we checked to see if the treatment had resulted in a hepatitis C cure. And then also we're following the babies for an entire year to make sure there weren't any adverse effects from the in utero exposure of ledipasvir sofosbuvir. And so to date, 8 of the 9 women have completed the treatment course and the study completely, and 1 is between delivery and the postpartum visit. And to date, we have a 100% cure rate with antenatal administration of ledipasvir sofosbuvir. The treatment was well tolerated by the women, and all the babies are healthy and doing well, and none of the babies have any evidence of hepatitis C infection. But again, that follow-up is ongoing.
What is the timeline here? How late in the stage of pregnancy can one begin to initiate the treatment?
Well, I guess you could initiate any time, but this was the first study, and so we decided to start between 23 and 24 weeks. It's probably better to start in the 2nd or 3rd, in the late 2nd trimester, after organogenesis has completed, to prevent the risk of teratogenicity. But again, this is a very small study, and so it's currently not recommended outside of clinical trials for hepatitis C treatment to occur during pregnancy.
Well, how do we get this into the general population? What's the next steps for that?
So the next step, this first study was ledipasvir and sofosbuvir, which only covers certain types of hepatitis C, and a good chunk of young people have actually infection with genotypes that are not covered by ledipasvir sofosbuvir. So we first need to do a small study like this in a pan-genotypic regimen. And then after that, we need to do a large multi-center study evaluating the efficacy and safety of hepatitis C treatment in pregnancy. Yeah.
Great. Well, I'm excited that you're doing this, and I hope that this pans out in a way that we can actually deploy it, because it seems so useful.
Yes.
I mean, I can't imagine, passing this on and not trying to stop it in its tracks.
And what we do see is that a lot of young women, they're healthy. They don't come into care unless they're pregnant.
Right.
And so this really is a window of opportunity for hepatitis testing and treatment.
And it's now your option to actually get out there and do shows like this, so we can tell people get tested before. Actually, get tested anytime, but certainly before as you're looking to have children.
Right, or ask your obstetrician to test you.
Yeah, exactly. Well, thank you so much. I really appreciate your time.
Of course.
Thank you.